Thank you all for joining. Welcome to today's webinar. My name is Whitney Dailey. I run the Purpose Center of Excellence at Allison, a global integrated marketing agency. And just as a little context, Allison's Purpose Center of Excellence is a dedicated team of subject matter experts who communicate across complex climate, sustainability, social impact, and social justice issues and the intersection that exists between these topics. Today, I am thrilled to introduce this important panel, which will discuss the impact of climate change on health, both physical and mental. This topic is especially important to me. As someone with severe asthma, I have had conversations with my pulmonologist about the challenges ahead, including increased risk of wildfire smoke inhalation and longer allergy seasons. And looking at the climate crisis through the lens of health, while it is an emerging topic, this panel will help us better understand the intersections and discuss the tools for navigating it. As an agency, we are committed to doing our part to address the climate crisis, not only through our work alongside leading clients in this space, but also through the commitments that we make as an agency, which is why in 2023, Allison became the largest agency to sign the Clean Creatives Pledge, in which we commit to refuse work from oil, coal, and gas companies, which are the largest contributors to accounting to the climate crisis, accounting for over 75% of global greenhouse gas emissions and nearly 90% of all carbon dioxide emissions. But enough about us. I am incredibly excited to introduce the group that we have here today. I'm joined here by experts in the field who include Lisa Harshad Patel, a pediatrician who has dedicated her career to finding opportunities to work at the nexus of climate change and health, working at both a pediatric hospital and serving as the executive director for the Medical Society Consortium on Climate and Health. We also have Sarah Newman, the founder and executive director of Climate Mental Health Network, an organization dedicated to understanding the causes of climate emotions and providing interventions and tools to address it. And finally, Renee Lertzman, a climate and sustainability psychologist and the founder of Project InsideOut, which provides resources and tools for climate action. Today's panel will be moderated by Bruce Y. Lee. Bruce is a journalist, a professor of health policy and management at the City University of New York, and an AI researcher, as well as the founder and head of various health tech companies and centers. He writes extensively for the general media, serving as a senior contributor for Forbes. He is also on a number of advisory boards and committees, including the National Health Institutes of Health, one of the connections between climate change, nutrition, and health. Before we begin, a bit of housekeeping. The panel will be recorded, and we will leave time at the end to answer your questions. So please ask us questions in the chat, and we'll do our best to answer those at the end. So with that, I will hand it over to Bruce.
All right, thanks, Whitney. Well, great to be here and great to be with such extensive expertise and experience in climate change and health. This, as many of you probably know, is the week of the UN General Assembly. So I've been covering a lot of the events, both the assembly as well as the many side events. And of course, the word climate change has come up multiple times. And when it's talked about, many times it's very high level. So when people talk about overall emissions around the world, global temperatures, these big picture things. And I'm struck by the fact that many times when I've written about climate change quite a lot, if you write to different people, sometimes these big ideas or these big thoughts get lost to the individual. They say, okay, well, let's see, global temperatures are going up. Okay, what does that mean to me? And all of you probably remember the term global warming. And I've heard people respond and say, oh, well, that sounds great. It sounds like a hug. The Earth is giving us a hug, and oh, warmer summers, that sounds great, et cetera. And that was going on for a while. But that's why I think it's really crucial to understand this connection between climate change and health. And we're talking about not just physical health, but emotional health, mental health, and those things like that. So I think it's great that we have this panel of experts to really talk about these issues, because these issues really hit home to the individual. And so with that, I wanted to give each of you an opportunity to really talk about some of the efforts that you've been partaking in or leading when it comes to climate change and health. And we can start with you, Lisa. Whenever people mention your name, they talk about, well, she's got all the information. She's got all the facts. She's the person to go to. So maybe you can talk about some of the things that you've been leading and involved in.
I don't know that I have all the information because my brain might explode. Because there's a lot in the field of climate and health. And I'm really grateful to be joined by such wonderful colleagues like Sarah and Renee as well. So I just want to share a little bit, Whitney. It was really, really instructive to hear how you've come to this issue, because it's very parallel with how I've come to this issue as well. I actually was an environmental scientist before I became a pediatrician, and this was 25 years ago. And in my mind, all these things carried together, but I entered the field of medicine. I did, training, and then I came out of it, and I thought to myself, I'll have time. There'll be time to work on this. I just want to focus on being the mom to 2 young kids. And then we withdrew from the Paris Climate Accord in 2017. We started having terrible wildfire seasons. I live in California. The sky turned orange for us. And I had 2 young kids at that point, and I realized that we had no time left, that this is where I really needed to invest my time and my energy. And so as I reflect upon all the various ways that climate change affects health, and we'll deep dive into this more, but on my way here, I was sitting next to someone who was coming for an investment opportunity here, and he was asking me about my work, and he was like, I didn't realize that climate change affects my health. Because I think up until now, when people think about climate change, they think about polar bears, they think about something distant in place and time. And as a pediatrician, I will tell you, we in the pediatrics world are now framing climate change as the single greatest driver for health for a child born today. And that is because of worsening heat waves that are dehydrating children and getting them into the hospital, wildfire smoke that is 10 times as toxic as regular air pollution, displacement from climate disasters that affects a lifelong of child's both physical, emotional, and mental health. So myriad issues, and I'd love to hear from the other panelists as well.
So speaking of mental health, Sarah, you have this climate mental health network, and as Lisa mentioned, many times people are not familiar, or they're not even aware of the health effects, including the mental health effects of climate change. So maybe you could talk a little bit about your network and the work that you've been leading.
Sure. And it's just great to be here today with all of you. So thank you. So I started the Climate Mental Health Network also because of a personal journey. I was really struggling with my climate anxiety, and I was experiencing a lot of anxiety and despair about the climate crisis. And I started looking for resources, and I found some resources that were useful, but I realized that there are tens of millions of people just like myself who are struggling with a range of mental health impacts of climate change, but didn't even necessarily have the language to describe what they're going through. And so I decided this is what I need to be doing. And so I decided to start this organization. And I mean, I'll talk about it later, but young people are really disproportionately, as Lisa mentioned, impacted from a mental health perspective of climate change. And so the organization has a very strong youth focus in our work. But it's not just about engaging, youth directly, but also engaging adults in their lives. So we do a lot of intergenerational work with parents and caregivers, as well as educators, both K through 12 educators, and informal educators. And the last thing I'll add is that our strategy really uses a public health approach because the mental health care system in our country is just so overburdened. There's so many challenges, financial, cultural challenges to navigate it. And it's, it cannot scale to respond to the magnitude of the impacts of the mental health impacts of the climate crisis. We need to look at this, that each person can be engaged and responding to it. And it also, I think, reflects, when you look at this from a public health approach, it really reflects the fact that the climate crisis is a collective experience. We're all going through this together, and that my climate anxiety is, yes, I'm experiencing this, but so many other people are, and that the response, when you bring it in a collective response, that's really reflective of not individualizing people's experiences, but making it a community approach, which is what we're all really going through. And that really helps with a sense of connectivity and resilience.
Thanks, Sarah. And Renee, Whitney mentioned, of course, to everyone that you're an author, you're a psychologist, and then you're the founder of Project InsideOut. So maybe you can speak a little bit about Project InsideOut, or give us the inside out about InsideOut.
Thank you. And it is exciting to be with all of you and especially with Sarah and Lisa, whose work I've been following for some time. Let's see. So essentially where I'm coming from is similar, where it was 30 years ago. So I'm dating myself when I experienced the inextricable link between the psychological field and environmental sciences and climate change. I was a college student and I was training as a psychologist. And when I came into contact with information about climate and the environment, to me, it was 100% inseparable. And so that's what I've been tracking for 30 years. So I do have training, psychological training. I was in the research field for a while, but at a certain point, I realized that what I really wanted to do was to translate and design and create resources and tools that take the insights, that take the wisdom, that take the best practices that have been generated primarily in clinical spaces, including public health, and see how we can make that usable and applied for those working to address climate change, regardless of how old you are or where you are. I began to recognize that to work on the issues, to be engaged with the issues, has a profound toll. And it's asking us to up-level our capacities to be what I call attuned, to really truly tune into what people's experiences are, and frankly, become more psychologically literate to understand why it is that for many people it's too overwhelming, it's too triggering, it can evoke an incredible trauma response. So Project InsideOut is an initiative that I was given support from the KR Foundation a number of years ago to do this as a experiment. And so I brought together a whole cohort of incredible advisors and especially people trained in the public health sector, and specifically motivational interviewing, which is the most evidence-based approach to shifting behavior. And so what you find on Project InsideOut are some tools and resources and 5 guiding principles that, when applied, kind of address how can we support our health and others' health as we're working on these very charged issues.
Thanks, Renee. So one of the things that I've written a lot about for Forbes and some other outlets that is misinformation, disinformation. There's no shortage of that. I actually have no, if I did nothing but write about that, I would have plenty of material each week or each day. So it's important to get a lot of the facts and the research out there. And Lisa, there is research, plenty of research showing these connections. Maybe you can comment on some of those things.
Sure. I've been in a lot of meetings this week where I really appreciated one of my colleagues. There was talk about, well, what more data do we need? And she said, and I agree with her, we actually have a good amount of data. And not to say that we can't continue doing more research, but actually we have a good amount now to just start taking action, and then we can fill in the lines later. As I mentioned, in pediatrics, we consider climate change to be the greatest driver of health for a child's health born today. And the reasons for that, it starts with, when we burn fossil fuels. And by the way, I want to applaud Allison for your stance on fossil fuels, which I'm also finding unique. When we burn fossil fuels, 2 things happen. We release particulate matter pollution. This is really tiny pollution that enters our lungs, our vasculature, and essentially sets off inflammation. And we have tons of great evidence for what that pollution means for a lifetime of a child's health. We know now that that pollution actually crosses the placenta into a developing fetus, because we've found evidence of that pollution in a developing fetus's lungs, brain, and liver. So that exposure window is longer than we ever thought. And this is particularly troubling because we made significant gains from the Clean Air Act to clean up our air, But because of climate change, we're seeing worsening wildfires that is reversing those gains. So a child today can expect to breathe poorer air quality than we did growing up, for example. So children are being exposed to this terrible air pollution, which in addition to driving 8 million premature deaths worldwide, more than tobacco, that particulate matter pollution is responsible for risks for cardiovascular disease, for certain types of cancer, for diabetes, reduced lung function, asthma, as an example. So that's the particulate matter pollution side. The other side is when we burn fossil fuels, we release carbon dioxide. And you were saying, you know, we've moved away from global warming because it wasn't great messaging. And so the way I talk about it, it's, yes, CO2 created this nice blanket of warmth for us that allowed civilization to thrive, but now that blanket has become a stifling one. But I also, Dr. Catherine Hayhoe calls it not global warming, but global weirding, which is, I think, a really great way to describe the fact that we're seeing these threats play out in different places. And so I said, as an example, we have evidence to show that wildfire smoke is 10 times as toxic to a child's health. We're living a natural experiment right now. We don't know. My son is 6, 3 years of his life during a period of rapid lung development. He's been exposed to this toxic pollution. We won't know probably for another 10 years what it's going to mean. But we know from the data from firefighters, for example, increased risk of cancer, cardiovascular disease, respiratory disease, heat as well. We don't know what the long-term implications are for a child's health. We do know that during periods of excess heat, there are people that are more vulnerable, especially the elderly, those that are incarcerated. Outdoor workers are highly vulnerable, several fold times more, particularly for death or poor outcomes as well. Periods of flood, homes get destroyed. They in places like Houston have become overwhelmed by mold because people try to go back in, and that early exposure for mold places you at higher risk for asthma. And then, of course, the mental health implications are profound. They follow children from Hurricane Katrina, and anxiety, depression, PTSD in these children that were displaced, their communities fragmented. And we're seeing that displacement and fragmentation play out all around the country, whether we're talking about wildfires or floods or droughts, as communities are having to depopulate or move.
And speaking of mental health issues, as a journalist, I need to follow social media. And it struck me that a number of years back, I started seeing the term climate anxiety appear on social media, first organically, but then it started becoming trending topics and things like that. So, and then Sarah, you mentioned this idea of climate and anxiety. The fact that has been trending on social media means that it's very common. Many people are experiencing it, and there's talk of whole new generations of facing this just as a routine thing, that they have to actually start facing expect to face climate anxiety. So maybe, Sarah, you could expand on some of the mental health issues.
Sure. Yeah. So, in addition to everything that you and Lisa were just saying, there's, research is suggesting that young people are especially vulnerable to the mental health impacts of climate change. As Lisa was talking about, their nervous systems are developing, and they're more susceptible to, the psychological impacts of extreme weather because of climate change, such as wildfire, displacement, things like that. And additionally, there's a lot of anger and fear in young people because they're not responsible for this. It's something they were born into, but they are going to live with the impacts of it in a way that I'm Gen X, we're all going through this, but they're going to bear the brunt of the consequences. And so there's been some really important research that has been done about this. Most recently, just earlier this month, The Lancet came out with a new report that is about youth mental health worldwide. And they identified several harmful megatrends, and one of them is climate change. Also, UNICEF had a report that just came out last month called A Threat to Progress, Climate Hazards on Children, and they included mental health in that, and that includes cognitive dysfunction, developmental delays, PTSD, anxiety, depression, things like that. And, you know, this is not unique to youth in a certain area. This is global. This is happening everywhere, including in the United States. And there was a study in the Lancet in 2021 of 10,000 youth worldwide, including 1,000 were in the United States. And in that study, they found that 75% said the future is frightening because of climate change. 56% said humanity is doomed, and 4 in 10 do not want to have children. I mean, it's really, really acute. And Blue Shield of California every year does a national survey of Gen Zers in the United States about their mental health. And the last one is 2023 that came out. They found that 68% of Gen Zers across the United States said that climate change is impacting their mental health. There was a slight variability. They found that 71% of youth of color versus 64% of white youth that were surveyed found that. You know, but I think that all of the emotions that young people are experiencing, you know, this is from both direct experiences like extreme weather, wildfires, hurricanes, and so forth, but also indirect from learning about it in school, the news, social media, all of these things are contributing to a range of mental health outcomes and emotions that young people are really grappling with.
So this week, I've been talking to a lot of people who are involved in climate change advocacy, or healthcare workers, different folks who've been attending the UN General Assembly and other events. And then when they get on the podium, or they're officially talking to me for an article or whatever, they try to be optimistic. They're leading the charge, et cetera. But then off the record, sometimes they express frustration, and then they look tired. They look tired, and they look like they've been struggling against this immovable object, or trying to climb this huge mountain. So one of the things that can be overlooked is the fact that you can be very energetic about trying to tackle this thing, but one of the risks is burnout, right? Right, Renee? I think you've expressed strong urgency in terms of addressing the burnout problem, and that you're really talking about mental health issues from climate change itself, but then these secondary issues as well. Maybe you could expand on that, Renee.
So yes, I think the lens that I'm wanting to introduce here is that we have to approach climate work and climate change through the lens of trauma, and the fact that it is in fact traumatic content and material to engage with. And it's my belief and experience that if we bring that lens, it should change everything about how we talk about and work on climate change, which means that we need to recognize that there are certain conditions and contexts that allow and enable humans to navigate and face hard things. And, Lisa, I'm sure you know this as a doctor, doctors need to be very thoughtful about how life-threatening or, various chronic conditions are engaged with and communicated. And unfortunately, a lot of people working in the climate space are at a moment where there's such a sense of urgency and high stakes that we allow ourselves to be driven by that, and in fact, end up burning ourselves out, and also alienating and turning off a lot of other people who we need to be on board right now. And so the approach that I've been creating over a number of years in partnership with clinicians and people in the health sector is precisely how we communicate and work with people on these issues in such a way that both supports our systems, creates support mechanisms, but also supports those that we're wanting to work with. And from my experience and the research, it's actually far more effective when we are more transparent and open and vulnerable about our lived experience versus putting on some sort of a hope, optimism. I call that cheerleading. I talk about there's a tendency to yell, tell, or sell. So yelling or educating or selling and pitching. And as an agency, I know you all can resonate with these very real dilemmas. How do we do it if we're not going to yell, tell, or sell? And the way we do it and the way I talk about doing it is guiding. How do we show up as compassionate, grounded, like self-regulated in our nervous system guides And guides have the ability to truly meet people where they are, to be attuned, and to also, frankly, take care of ourselves. So there's no work out there in the world on, since we're talking about health, there's no work out there, in my view, that is effective unless we ourselves are doing what we need to do to take care of our own health and well-being. And I'm not talking about just self-care, go out and meditate in the woods. I'm talking about the entire way we approach working on climate change, I think can be and needs to be grounded and rooted in what we know about mental health and about human psychology.
Well, one of the things that I've written about, unfortunately, multiple times over the past few years is the hottest day on record, right? So I remember last year writing, this is the hottest day on record, and then, but actually this is the hottest day on record, and then this year, actually this is the hottest day on record. And so we're talking about heat waves, obviously, and the statistics are getting worse with heat waves, right, Lisa? And there was a study that was published, I think, in the Environmental Science and Journal of Environmental Science and Technology that looked at what would happen if I think it was Phoenix were to suffer a heat wave, and there would be all these different types of consequences. Maybe you could expand on that further.
Yeah, I do want to lift up what Renee was saying before I dive into this answer, because it is a little bit so what the paper did was predict what we can expect with climate change is we can expect more black and brownouts. Because what happens during periods of extreme heat is that people crank up their air conditioning. And the hotter it gets, the more people are cranking that air conditioning up, the higher the possibility that power will fail, although I'll have to do rolling black or brownouts essentially to make sure that everybody gets some electricity. In this paper, they took the scenario that Phoenix is in the middle of a heat wave and the city loses power and what would happen. And they predicted that half of the city would end up in the emergency room with that. And the point the paper was trying to make is, first of all, how dependent we are. We know that air conditioning is protective for cooling, but unfortunately, there are populations that don't have access to air conditioning, whether it's from a black or brownout or whether it's a family that can't afford air conditioning. I live in Northern California. I grew up in Houston. In Houston, 80% of households have air conditioning because that's the climate is adapted. Other parts of the Pacific Northwest, it's something like it's increasing, but it's something like between 30 to 50% because we haven't needed it in the past. So it just points out the vulnerabilities of certain populations to extreme heat.
And so obviously there are populations which can't afford cooling devices like air conditioning, but what other populations are more vulnerable and what makes them more vulnerable?
Yeah, and I'd seen this question from the audience. So we map out vulnerability by sensitivity, exposure, and adaptive capacity. And when we look across those, children are more vulnerable because they're more sensitive to these types of environmental threats. They spend more time outdoors. Pound for pound, they can breathe in more air pollution. They're dependent upon their caretakers to keep them safe. I've unfortunately cared for a number of toddlers, infants left in hot cars, for example, and they can't get themselves out of that car. The incarcerated individuals, highly vulnerable populations. We've unfortunately seen a lot of cases of people that are incarcerated that were suffering from extreme heat because the prison facilities were not appropriately equipped or caring for those inmates as they should have been. As I mentioned, outdoor workers are more vulnerable. The elderly or those that are experiencing social isolation are also highly vulnerable. I want to applaud New York City, which has a buddy system, especially during periods of extreme heat, for people to be able to check in on each other. In France, there was a terrible heat wave and there were a number of elderly who died. And a big piece, they think of that, was that social isolation where they didn't have anybody to check in on them, for example. Those are the big populations, and Sarah and Renee, I'm not sure if there's any that I've missed that you might add to this. Oh, one more. Those with chronic medical conditions or those that are needing to take medications, they can be vulnerable as well because there are certain medications, especially if it's extreme heat. Psychiatric medications, you can be on medications for heart disease, blood pressure that can make you more vulnerable during these periods.
And Sarah, I would also think that, vulnerability extends to mental health. People are at different situations in their lives and can be particularly vulnerable to the impact of climate change. And there's something called a climate emotions wheel that could be quite helpful. So maybe you could expand on what's meant by this wheel.
Yes. And before I do that, really quickly, I just wanted to go back to the youth activism really briefly and just say that I think it's really troublesome when there's messaging and an effort of like youth will save us, or this like youth-led response to the climate crisis. It places an undue burden on young people. It creates a lot of stress, anxiety, anger, just a range of issues. We have a Gen Z advisory board at our organization. One of our Gen Zers we had a panel, she spoke yesterday how she was burned out at the age of 18 from all of her climate activism work. And I think it's, when we're talking about from a mental health perspective and, Renee's extraordinary work on this, asking youth to like lead a movement or like it's up to youth or all of those things is really, really problematic. And instead, I think it's really about bringing people into an intergenerational engagement in ways that are emotionally healthy. So I just wanted to add that. But the climate emotions wheel, which I just put in the chat, is something that is based on what people might have already seen, an emotions wheel itself. And we worked with a Finnish researcher named Panu Pakala, who had done an article called The Taxonomy of Climate Emotions. And that was looking at what are the most common emotions that people are experiencing because of climate change. And so we overlaid that onto what is commonly used as an emotions wheel. And this has been really an incredible tool for people to use. We've gotten so many requests for it. It's now available in 30 languages. It's being used in schools, libraries, community groups, workplaces, therapists, individuals, homes, families around the globe. And we keep translating it into more. And we actually just made a version for young children in emojis for kids who aren't able to read, so that they're able to communicate how they're what they're feeling. But it's really, we found a really helpful tool for people to be able to start the conversations about what they're experiencing with climate and to name it and to be able to recognize that there's myriad emotions that you're going through and that it's, not a static experience.
Sarah, I've heard what you first said a lot, where there's this expectation that, oh, well, someone's like cleaning up after a party. Say, oh, younger generations will clean up, and I've heard people from different younger generations saying that, well, if we feel like there's a party been held and we're left with the bill or left with the check or what have you, and so this climate emotions wheel, it sounds like one of the things that could be helpful in terms of addressing some of these mental health issues. Renee, we clearly, we've outlined a lot of the problems here, and there's also a strong interest in moving towards solutions. So people know, say, okay, we've got a problem. We've got just a physical health problem. We've got a mental health problem, an emotional health problem. What are some of the ways that we can move more towards solutions?
By talking about our feelings. I really want to underscore this. I'm going to just be really repetitive. Like, these are charged, complex, emotionally difficult issues to confront. I don't know how you all were feeling as Lisa was speaking. I was paying attention to my body, hearing the litany of threats. That's what many of us are going through. The antidote to moving from that kind of overwhelm, paralysis, is not to simply push people into action and solutions. We need to create context to metabolize, to make sense of, and to reflect. So the reason why what Sarah is doing and what Panu is doing and what lots of people are doing, there's a whole movement of climate psychology I feel I need to acknowledge, which is we're standing on lots of researchers and innovators and pioneers. I won't name them all: Britt Ray, Caroline Hickman, Sally Weintraub, Lise Van Susteren. There's a whole community of people working on this. And the reason why is because we do need to move into solutions. We need to move into action, but we need to understand the psychology of how best to do that. And one of the most powerful ways of doing that is by naming and acknowledging how we're feeling, which is completely seems paradoxical. It is neurologically, it changes our neurochemistry when we talk about how we're feeling and when we feel seen, when we feel heard, and when our experience makes sense. That is the power of the emotional climate wheel, is it helps people identify their feeling and experience. Then we can look at, how do I want to respond? What makes most sense for me to respond? It's not about pushing on do, because that is a fast track to burnout. And that's why a lot of young people are burning out, because there's a constant mantra of take action, take action. And it's like, okay, we're talking about systems of this is symptoms of a system that is no longer working. And what we're talking about is how do we address the symptoms? We also need to be able to look at, well, what is actually really going on and why are we in this crisis, right? And not everyone's going to be drawn to that level of investigation, but it's not really coherent. If you go to a therapist and you're dealing with crises in your life, you're not going to only deal with the symptoms, or that's not good therapy. Same goes for the climate movement. Unless we allow people to process and kind of be with, like, oh my gosh, this is a lot, this is heavy, this makes me feel all those things that Sarah spoke to, then it's like, okay, let's go. But if we don't do that, we are bypassing, and we're not being responsible change leaders and change makers and practitioners.
Mhm. So it seems like part of this is recognizing that there is this thing called climate trauma, that there is something, and it's something that's going to be growing or has been growing. Maybe Sarah, you could help people understand what this term means and what really are the consequences here.
Lisa had already talked about, for example, the child survivors of Hurricane Katrina.
Mhm.
And, there's been increasing studies about what's happening, particularly to young people after going through a climate disaster. And there was, and not just children, but also adults. And so there was a study that was done by some University of California researchers. And this was looking at survivors of the Camp Fire in 2018 in California, major wildfire. And what they found was that people both in the community, whether or not they were directly exposed, so people both directly exposed and not directly exposed, they found in their study they had changes to their cognitive function. And then there was just recently, a couple of weeks ago, a study that was just released that found that wildfire smoke increases risks of anxiety and depression in children. This was done by a team at CU Boulder. There's also been some research. There was some research that was done about children that were in utero during Hurricane Sandy here in New York City. And this research found that those children had higher rates of anxiety than compared with children that were born before or after. They had higher rates of attention deficit disorder and so forth. So it's really, there's so many impacts to young people of what they're going through, and it's affecting their ability, how they're functioning in school, how they're engaging in their families and so forth. We have done some research with some middle school teachers around the country. We're going to be releasing the data next year, but we have a lot of information about what is happening with some students who have gone through climate disasters and how this is impacting how they are in classrooms, for example.
Thanks, Sarah. And Renee, what other things can be done about climate trauma? How can that be better addressed?
So what we know from the research working with trauma and trauma-informed practices is there's a few things that we know that have been, grounded in lots of evidence. which have to do with people feeling connected. And I mentioned earlier, seen and heard and allowed to process. So it's very relational. And that's why I talk about this concept of attunement, which is to say when, people feel attuned, we feel safe enough to allow ourselves to be with what can otherwise feel really overwhelming and intolerable. So therefore, a lot of what we're seeing increasingly are the emergence of small groups and circles and what's called climate cafes. And what I work primarily with organizations and practitioners and people who are working kind of in that more organizational setting, whether it's business or healthcare or government. And so in those kinds of settings, what we can be doing is thinking about creating spaces where we bring people together, and it's much more of a conversation than a share out or a presentation or I'm going to teach. It's more, let's look at what's happening and let's talk about what this all means for us. And that's very simple and powerful. So I keep coming back again to the power of small groups. I think of this as containers or circles or spaces, and also taking responsibility to ensure that we are training ourselves and skilling ourselves up to be effective at facilitation, because it's a very complex skill that not everyone has or even wants to have. Not everyone has to do it. But again, it goes back to medical. I keep thinking about, the health practitioner, a lot of doctors need to go through some sort of training to know how to communicate with people skillfully, because it's so personal, it's so existential. And I think the same goes for people working in the climate space. And these tools and resources are available to tap into.
Yeah, it seems like any conversation about climate change, it goes incomplete because it's such a big problem, right? It affects just so many. So you're talking about the world, right? It's affecting everything in the world, and so we've talked a lot about the mental health things. You've mentioned some aspects of affecting the lungs and cardiovascular, but we've only skimmed the surface. There's issues with food, right, and housing, and certainly vector-borne diseases, all these different types of things. So there's no way we can cover it within this short period of time. But maybe mention some of these other things, these connections, just to offer the science.
And before I delve into that, I've so appreciated what Renee and Sarah have been saying about how we communicate about this crisis, because what has struck me, the consortium where I work, we're actually based at a Center for Communications, and something has always felt a bit. I think we've often looked at, well, if we can raise people's consciousness about fossil fuels the way we do about tobacco, we can get somewhere. The trouble is, and I think, Renee, this is what you're getting to, is that, and that what you've just mentioned is that climate change is so much more complex. And so I think we can't just think that we can put out simple messaging and it's going to get across. It really takes more of an organizing approach to what Renee was saying, and it takes personal conversations, it takes curiosity, it takes humility. And so I go about my day, and I'll usually find a way to work in a conversation with the barista or with somebody on public transportation with me. And I'm just curious and let that person sort of talk about and I'll link climate change sometimes into the conversation if it's a hot day or a smoky day. But not make it like a boom, boom, boom in your face, but make it personal and see where that person is and see if they might be opening to exploring it more, because this is what I think it's going to take. There are a lot of us that are deeply immersed in the space, but what about everybody else who's not? And I think for those everybody else that's not, it takes this curiosity and very personal approach for how it is affecting them, because the issue is so complex. To the question of, we consider climate change a health threat multiplier. So when we think about existing, and sorry, I left out a very big vulnerable population that I just want to rectify, which is communities that we've made vulnerable by structural factors, whether it's racism or poverty. And so when we think about what we call the social drivers of health. These are things, this is the conditions into which you are born, live, work, play, and pray and love. We understand that what your housing is like matters to your health. Your access to food matters to your health. Your access to green spaces matters as well. Violence in the community, your access to health insurance, whether you speak the predominant language in terms of your access to resources. And climate change interplays with every one of these things. I was actually speaking to a gun violence advocate, or a advocate to reduce gun violence, I should say. And I was saying how I care about gun control in this country because I care about climate change. And she's like, I don't see the link there. And I was saying, well, we have more guns than we have people in this country. And we have good research to show that during periods of extreme heat, there are more episodes of violence. And now you have a gun available, right? And so these kinds of things should trouble us. Every issue you can imagine, climate, we can't separate ourselves from the physical and natural world upon which we depend. And so every one of these issues interplays with climate change in different ways.
So it seems like in many ways it's pulling the covers off other existing problems, and it's this feedback loop, which just makes everything worse, et cetera.
Yes, exactly.
So
I just have to jump in.
go ahead.
I'm sorry, but that intersectional piece is brilliant and essential. I just got really excited hearing you because what we're needing to do is like literally connect the dots. And that in itself is a psychological kind of, for a lot of people, it's like, whoa, like I never even thought about that. That's brilliant. And that's also really helps us kind of appreciate this is not, can't find the analog of tobacco, or you know what I mean? It's really systemic. So thank you so much for sharing that.
One of the things that has been really good about this conversation is that we've already talked about solutions. You've already discussed ways to address some of these issues. I know that sometimes some climate conversations can, someone will come in and say everything sucks and then leaves. So we definitely want to continue with some of these solutions and help pave the way forward. So you've all mentioned some solutions, but what are some other solutions that you think would be helpful? Again, we can't cover all of them obviously within this, but just maybe a taste of some of these things.
Vote this cycle and talk to your decision makers about climate change. As a personal issue, as a health and a mental health issue. So the consortium, we organize mostly physicians, but across all health professionals to talk about climate change, like an issue of health and health inequity. And when we go meet with our decision makers, it's a little bit of a cognitive dissonance for them. They're like, oh, I expected you to be here to talk to me about reproductive care or some of these other topics that seem they see the link more clearly. And so they're always surprised to hear from doctors and nurses on climate change. But they shouldn't be, right? We know it's profoundly affecting health. So talk to your decision makers about how climate change is affecting your health and the health of your loved ones. And the other thing that this does is that it actually removes climate change out of the realm of toxic politics and where it belongs, which is in caring for one another. And what we all want, right? Which is healthy lives for ourselves and for others. I think across all of us, we probably have like a litany of things where you could get involved. But the other thing that I want to lift up that Renee said is if this is an issue, there are a group of us that work deeply in the space, and then there's a larger group that are starting to get engaged, but not quite sure how they feel. And then a small percentage of people that just don't care about the issue at all. And so for that group that's in between, like trying to figure out how to engage, join a group for all the reasons that Renee said. And also because some of the best friends and community I have made has been through my climate work, which I've gotten to see this week. And that has been the richest part of the experience for me, is getting to meet other people and connecting with people on this deep emotional level of caring for each other and caring for our world. And so flipping this from like problem to opportunity, the Surgeon General says that Social isolation is the equivalent of smoking 5 cigarettes per day, and that we need to do more for connectedness. Climate solutions are solutions for better connectedness with each other, with what's going around us, with our natural world. And so this is a way to really reframe the world towards positive interactions with each other and with our external environment.
So before we jump to the questions from the audience, I also wanted to give Sarah, you and Renee an opportunity to touch upon some of the solutions. Again, we don't have enough time to go through all possible solutions, but what are some of the things, Sarah, that you would suggest doing?
Yeah, and just to add on to what Lisa was saying, I think that when you start with addressing mental health, it's a way to not only help people navigate their climate emotions and giving them this, helping them understand how they can practice self-care in community, in their families and so forth, but that it really is an opportunity to help them understand that they have agency and that they have a role to play in addressing climate change. There's a lot of people who are like, it's too big, I'm one person, my actions don't matter, or, we're all doomed type of thing, as opposed to being in a place of, we're in this critical moment, I have a role to play, my voice matters, my actions matter, I have agency, and I'm gonna bring that agency into my community. Our communities have agency. So I think it's that addressing climate through the lens of mental health is like one of the most critical ways that we can grow the number of people who are actively responding to climate, but also feel that this is not something that is up to someone else, that they have a huge role to play and can control how their lives are. And I can just briefly share the Climate Mental Health Network. We have a lot of resources, for example, for parents on our website. How do you talk to your kids about climate change? How do you talk to them about their climate emotions? How do you practice self-care as a parent? What you need before you're even engaging your kids. So that's on our website. We have a lot of free resources that are available for download in addition to the climate emotions wheel. And we also have some programs and resources for educators, both formal educators and informal educators. And it's a area where we're going to be expanding our work. We're doing a big pilot right now. But I think also just the last thing that I want to add is that, that this goes back to what Renee was saying, just being in community with people is so essential. This is a collective experience, and the response to it needs to be a collective response, and that no one should ever feel alone with what they're going through in their climate emotions. And, just talking about it with people, as Lisa's doing with the barista and so forth, and just really that is so important to destigmatizing this, because it is affecting everyone. It doesn't matter what your political affiliation is. It doesn't matter what language you're using. There's no way to deny what people are going through because of the climate crisis.
Thanks, Sarah. And Renee, thoughts on solutions?
I'm going to be very provocative and say I don't use the term solution
Okay.
because talking about this as a solution puts us into a mindset that can lead us to become more of that kind of individualized, like, what can I do? So I like to experiment with intervention or strategy or, what have you. But I really feel like the solution, that's a problem solution framing, which isn't to say there aren't specific problems to solve, but this is much bigger. And so just offering that reframe. And I go back to, so Project Inside Out, it's projectinsideout.net, was funded by a grant. We're continuing to need support to keep it going. Right now, it's still up and there's amazing resources. There's 5 guiding principles that, if we apply, will change the way we do this work. Attuning, revealing the hard stuff compassionately, equipping ourselves with tools and resources like Sarah's doing and offering, convening in small groups and whenever we can, and sustaining this work for the long haul, for the long term, and not not blowing ourselves out or burning ourselves out with like the big climate week, you know, the big launch, the big this, the big that. So how do we sustain this for the long term in community?
So one of the solutions is to maybe not use the word solutions as often. Again, lots to talk about. We could talk for hours about this, but we also wanted to get a chance to move through some of the audience questions. So Whitney, I know you've been collecting some of the questions, so we can segue to this part of the discussion where our panelists can address the different questions. So Whitney, what are some of the questions that have come up?
Great, thank you. We have so many questions. We won't have time to get to all of them, but we will follow up with those who ask questions that we're not able to answer live. But I did just want to call out in case folks were not able to see in the chat, Sarah Newman's the emotions wheel. So if you're looking for that online, it is at climatementalhealth.net/wheel. So just wanted to call that out before we go into the questions. The first question that we have, I think might be for you, Renee, but welcome all of the panelists to answer. Are there other climate psychologists and how do I find one? Is there a directory?
Yes. The climate psychology movement has been growing exponentially over the past 20 years, especially the past 5. There's the Climate Psychology Alliance in North America. There's the UK base, which was the original CPA. Leslie Davenport is an incredible leader in the space in North America. There's there's a lot of resources. This is also where Sarah's work is very much oriented. But yes, Britt Ray has been writing about this. Jen Dredd is her newsletter. It's a very vibrant space.
Thank you. And Sarah, I believe the next one is a follow-up to something that you were discussing, which is around, you know, the burden that's being put on Gen Z. Renee, I know you touched on this as well, to advocate for change and kind of push the boundaries. What are some actions that other generations can take to combine forces and help at this time?
Thanks. It's such a great question. And I think it's really important, one, to stop with this youth will save us and this kind of putting on a pedestal that look at the youth leaders and they're the ones who are going to lead the climate movement. There's incredible people who've been working on this for decades and decades and decades. And we're not where we want or need to be on climate, but that's not a failure of their leadership, their work, their organizing. It's, you know, there's a lot of reasons why we're not where we are on climate. And I think it's really important for young people to see themselves stepping into a movement and that there's a hand being extended to them by people of other generations. And that this is really an opportunity for them to come in and bring their skills, you know, their passion, but that it's not up to them. This is not their responsibility. This is a collective experience. And soon enough, they're not going to be the young people and there's going to be a whole new generation. And, you know, there's been, you know, from my personal conversations with young people, their burnout. I mean, I find it bad. It's just unbelievable that people are like 18, 20 years old and struggling with burnout. And I think it's also, you know, what Renee is doing really reflective of like, what is the nature of engaging in climate? And we really need to think about our emotional well-being and that there's a lot of kind of toxic behaviors and approaches sometimes in how we're addressing climate, and that, you know, this is not healthy for anyone, but particularly young people. And so, you know, like I said, we have our, you know, guides on our website for parents. We recently did an intergenerational webinar, how to navigate climate emotions through an intergenerational engagement. And we did it in partnership with Third Act, which is a group that's focused on elders engaging in climate, and another group called Co-Generate. And we had 750 people register for this, which I found extraordinary because I think it really reflects the desire of people to work across generations. And there's research to back this up. So I really think it's important to support youth in their climate journeys and to do it in partnership with them and to really see us as a mutual relationship. I'm constantly learning from our Gen Z advisors, for example. I hope they're learning from me, and that it's really, you know, a two-way relationship where it's leading to growth.
Thank you. And we are at time, but again, this was such an incredible conversation. Lisa, something you were saying about kind of being in a coffee shop and trying to talk to someone about climate and the complexity of the situation and how do we distill down these messages made me think of another conversation I had with the chief climate officer at Time last week. And she said, the climate crisis is a communications crisis. And so I really value everyone's perspective today and giving us some tools and maybe not solutions, but some items that can help us in each of our journeys and in the work that we're doing. So finally, just huge thank you to Lisa, Sarah, Renee, and Bruce for lending your expert voice and insight to this important conversation. I feel we only scratched the surface, so hopefully we can continue the conversation and take care. Thank you all.